All right, so with visceral mobilization, you can get into the nitty-gritty of a lot of detail. IPA approach has a visceral functional mobilization class. Gerrald has like 30 plus classes that get really in detail, and then there's other groups as well. So for the purposes of what we are going to teach with our mentoring is we're just going to stick to a very general approach, okay? So if I'm thinking about the viscera in the abdominal region, I want to see how well can that whole unit of organs move in different directions, okay? So I can start by placing my hands, we can pull down a little bit. I can start by placing my hands laterally or towards me, okay? And I can see how it pushes away. I can see how the whole unit moves towards me. I can see how it moves inferiorly, and I can see how it moves superiorly, okay? And that's gonna be kind of most of what we're gonna stick to. You can also check on diagonals, but really, we just wanna see how it moves, and if there's a direction that doesn't move very well, we're gonna use functional mobilization to try and get that entire kind of mass of organs to move a little bit better, because that's gonna affect, it can affect a lot of autonomic things, but also it can affect mechanical things in our spine, ability to use our diaphragm, ability to stabilize, so multiple reasons to treat this area. All right, so I'm gonna start by sinking in to her abdomen, right? I wanna get some depth, so I'm gonna just kind of melt into her abdomen, and then I'm gonna see how does it push away from me. I'm taking up that excursion, and then I'm giving it a little spring test, and that's pretty springy. Also, I can sink on the opposite side, sink down and in, and then pull towards me, and there's a little more restriction there, although I'm not sure if that's skin and superficial fascia restriction. Pull towards me, and there is a little bit more restriction there. I can come to go inferiorly. I can sink just below the inferior border of her rib cage, right there, and then I can see how does everything move away from her thorax, and then I could sink all the way down. You okay with me here? I can sink all the way down here close to her pubic bone and see how does everything move superiorly. And that is the hardest infill for her. So how are we gonna mobilize this? We could do a little slight anterior pelvic tilt. So go ahead and, and that engages immediately, and let it go. All right, breathe in as you do your anterior pelvic tilt. That's it. Good, and out, and let that go. Good, and again. Good, and out, and let it go. I could have her slide her right leg out. Whoop, and back up. So that's a good one, and out. Good, and back up. I can have her do her left. And back up. That doesn't do as much for me. I could have her do a little lower trunk rotation. So go ahead and take your knees to the left. That's great. And back up and to the right. And I'm following the infield. It's like when she goes left with her knees, I'm having to kind of like pull up into her right. And when she goes right, I'm having to kind of change my force to pull up into the left. The most restricted is when she goes to the right, there's a pull on this angle right here. So I could stay straight on, but it's not as hard of an infill as if I kind of shift my hand contact over. So you kind of want to just follow the restriction, and now I can just have her go on pressure, off pressure. Good, and she could breathe in as she comes back up, out as she drops down. That's it. And I'm just maintaining that barrier. Okay, so this is a very general way to mobilize. I would just group all of that viscera together as a ball, and we want that whole unit to be able to slide in kind of 4 quadrants, okay? You can also check diagonals and do it that way. You can use pelvic rotations. You can use lower trunk rotation. You can see what happens whenever you straighten a leg out. You could even have them raise one arm or the opposite arm or both arms up overhead. So you have multiple options of functional mobilizations once you find the direction of hardest infill, okay? So visceral functional mobilization generally in the hook lying position.